Hey everyone, we are going to work on a little bit of a breathing moment here in this practice. One of the things that you'll want to do before joining me in this practice is making sure that you've gone and blown your nose so that your nose is clear, because we are going to be directing our breathing in and out through the nose throughout this practice, and working on our 360 breath by breaking it down a little bit into component pieces and then building it back up at the end to something where we are breathing into our full breathing apparatus, okay? I should also say at the beginning that sometimes these types of breathing practices can bring up certain discomforts and anxieties and things for us, and so I would encourage you to approach this practice with great care for yourself, okay? So if anything comes up for you during this, know that you can pause at any time. You of course have permission to do that, and take the time that you need and be gentle with yourself as you approach this work, because sometimes things can come up, okay? So I just want to caveat the practice with that, and then you can adapt and modify things as you need based on the results or the things that are coming up for you during this work, okay? We are going to be breathing in and out through the nose, and to begin with, we're going to be seated, so make yourself in a comfortable seated position. You'll also need some kind of a bolster or a series of blankets for some of the other work that we're going to do as well. But to begin with, we'll start seated, and the first piece that we're going to do is we're going to restrict our breathing to one nostril at a time. Now, this is one in particular that can make us feel a little bit like there's not enough air coming in. And again, I would encourage you to just be gentle with yourself and take it gradually. The idea with restricting breath to one nostril at a time is to strengthen the musculature of the nasopharynx. So in the back of the throat, we have a number of muscles that help to drive the breath in and out. And when we restrict our breath, it forces those muscles to do more work. And this is helpful for things like snoring and sleep apnea and what have you, where these muscles of the nasopharynx aren't necessarily as strong as we'd like them to be, okay? So just start with both nostrils at the same time, breathing in and out, nice and slowly. And then when you feel ready, lock one nostril off. And just to begin with, keep your breathing at a normal depth. There's no need to increase it or decrease it at the moment, just let the depth be normal. Just keep directing the breathing in and out through one nostril for now. You might decide to take more air in each time. If you're feeling like you need a little bit more, encourage a little bit more breath in, a little bit more volume of air in. Taking a couple more breaths like this. And then releasing that block, breathing in and out through both nostrils for a few moments. And then when you feel ready, block off the other nostril. Again, using your breathing depth as needed to ensure that you're getting enough air. Another few moments here. You may even notice that as you draw the breath in, one side might demand a little bit more work of the musculature of the nasopharynx than the other. And then releasing that block, breathing in and out again for a moment with both nostrils. You might have the sensation that there's all of a sudden an abundance of breath available. And then the next piece that we're going to work on is some diaphragmatic breath. Now, chances are that you're already somewhat familiar with diaphragmatic movement, because it has been quite a popular topic of a lot of yoga teachers of recent years, and oftentimes we encourage the idea of belly breath, and so I'll be talking to that in a moment. And one of the things, so you may find that this particular work is a little bit easier for you depending on how exposed you've been to the practice of belly breathing, so to speak. And then if that's the case, you'll likely find the second portion of the work, the costal breath, to be a little bit harder for you. And so you also might find it to be the opposite way around as well. If you have worked historically on costal breath and not so much on diaphragmatic breath, the first piece is going to be somewhat challenging for you, I would say. Okay, so with your bolster or with your stack of blankets, we're going to lie down on top of it so that the support is right over the top of the abdomen, inferior or below the rib cage. Okay, so position yourself so that you're coming down onto that prop, so that it's inferior to the rib cage. And what we're going to do is, placing this prop here essentially places load on the diaphragm for us to, what we're going to do is we're going to work into that load. So we're going to try and push that load away. And that is the intent here, is to encourage the movement of the diaphragm. So when you breathe in this position, I'm going to encourage you to take your breath and try to push the bolster or the blankets away from you as you do it. So breathing in through your nose, we're going to take a little bit more air in than we normally would. And as you take that air in, try to direct it downwards and then into the prop specifically, so that you feel your back starting to lift away from the prop, okay? And then as you get used to that sort of organization of directing breath, start to add a little bit more volume in until you get to a point where, as you take more volume in, the rest of the abdomen starts to move as well. Okay, so breathe in gradually and fully until you get to a point where the ribs then start to come in and move. You may even feel at the top of the inhalation, you may even feel almost like a bit of a shudder, I guess you could say. And that's a good sign that we are getting to the end range of where our diaphragm can move at this point in time. Taking 3 more breaths here. Try to keep that breath moving directly into the prop. one more. After that last breath, come on up for a moment, and we're going to move the prop a little further up. And now what we're going to do is direct our breathing costally. So in order to develop a full 360 breath, we not only need to train the diaphragm and the nasopharynx, but we also need to train the intercostal spaces. One of the things that I've found over the last number of years working in the yoga community is that when we work primarily on diaphragmatic breath, we end up losing a lot of the focus and a lot of the ability to move costally. And so it's really worth training costal breath separately before we then reintegrate all of those pieces together. So start with your knees off to the side of the prop, and then bring your chest down onto the prop. We're going to start in a twist with the load now on the ribs. Okay, so this load restricts the ability of the intercostals to move, and so it's going to make it harder to breathe. The little twist hopefully also helps to restrict a little bit the diaphragmatic breath, because this time we're going to try and prevent the belly from expanding, and we're going to try and move our breath costally instead. So again, we're going to be pushing the prop away with the force of your breath. So try it out. If you notice your belly does expand, you might bring your knees in a little closer, or just go a little bit slower and really try to limit the amount that the diaphragm is moving for now. In a similar fashion to the diaphragmatic work, you might like to take in a little bit more volume of air incrementally until you gradually get to your maximum volume where you are able to expand the rib cage. When you get to that volume of air where you are at that sort of moment of shuddering, or the breath doesn't feel like you can take any more in, see if you can pause there without closing off the nasopharynx. Just pause at the top just for a moment and then let the air out. Taking 3 more of these. Just a momentary pause at the top. 2 more we've got. And then when you've finished your 3, keep the knees where they are, but we're just going to turn it on our side now. And the top arm, take the wrist in your other hand and encourage it over the top a little bit more so that we're getting a little bit more lateral flexion in the spine, and therefore on this side of the rib cage we're encouraging a little bit more opening of the intercostal spaces. So set yourself up, and then in a similar way we're going to push down into the prop with our breath and see if we can lift up as well with our breath, trying to limit the diaphragmatic movement here. Gradually trying to get towards that top volume of air. Three more. See if you can pause at the top for just a moment, just a split moment, and then deflating from there. One more. And then at home, you're just going to sort of roll over to the other side, take the knees the opposite way, and set up for the twist work on the other side. I'm just going to do a little shimmy here so that I am facing you. Knees off to the side. Turn the torso so that the rib cage is down on the bolster or the series of blankets that you've got, and you're in a little bit of spinal rotation. And again, here what we're trying to do is push into the prop so that we can work the intercostal spaces, work the intercostal muscles a little bit. Trying to limit diaphragmatic movement once again, and incrementally adding more breath volume each time. The work of training our 360 breath is important for a number of reasons. One, when we have control over how our breath can move, and when we utilize all of our breathing apparatus, we have a greater capacity to continue working when our breath is challenged, as in we often have a little bit more space. And also a lot of these muscles that are part of our breathing apparatus are also considerably important parts of other kinetic chains that move throughout many different parts of the body. And when one part of a kinetic chain is not functioning well, the likelihood of other parts in that chain functioning optimally is low. And so we have to think of our movement, our breath training, we have to think of our breath training as movement training. Because when all of our breathing muscles work well, we have a greater likelihood of our other movements being sound and stable and supported as well. Just take a couple more breaths here and seeing if you can pause at the top. After those couple of breaths, we're going to come into our lateral flexion, taking the top wrist with the other hand, giving yourself a little bit more length there, and then encouraging the breath again both to push down into the prop and also then to lift up on the top side. When you get to that breathing volume where you feel like it's the maximum volume without including any diaphragmatic action, remember to pause for a moment at the top without closing off the back of the throat, the nasopharynx. Just for a moment, just for a pause, and then deflate from there. 3 more. One more breath. When you finish that breath, come on up to a seated position. You might also prefer to do this lying down. So you have the option to lie down or to be seated. And we're just going to integrate for a few moments here. So you might find it helpful to place one hand on your chest and one hand on your abdomen, on your belly. One of the things that I would also like you to keep an eye on though is the movement both laterally and posteriorly of all of those components as well. So not just moving forward, which is one of the disadvantages of being lying down. When you lie down, you get less posterior movement. And though sometimes it's easier to lie down and find everything else. So you work with that juggle at home. If you have one hand on each of those parts, then don't just think about pushing into the hands, think about moving as though all of this cylinder is moving out at the same rate, okay? They won't actually, but just think of it like that. So breathing in and out through your nose, thinking about the abdomen expanding through all directions, and think about the chest cavity expanding through all directions. I'm going to get you to start with 3 deep breaths. It can be easier for us to feel that sensation sometimes when we take deep breaths. But then what we're going to do is incrementally lower the volume of our breathing to a point where we are working with a minimum breathing volume and still utilizing a full 360 series of actions to create that breath. So taking those 3 breaths initially and trying to move it all around in all directions. And then after those 3 big breaths, just little by little, on each repetition of breath, reduce the amount a little bit, reduce the breath volume. Incrementally lowering until you end up with a breath that is of a normal depth. We call it our tidal volume of breathing. It's the depth of breath we take when we're not thinking about breathing. And we are still thinking about it because we're trying to make sure that it's moving evenly throughout all of our breathing apparatus. If you feel like you lose that connection with the full movement, the full 360 movement, by lowering the volume, increase it again and again, then start to gradually and incrementally lower it down. It's almost like a progressive unloading. one of the ways, as you continue here, one of the ways in which you can utilize the full 360 capabilities of our breathing is whenever you find yourselves in twists in other movement practices that you do here, think about where the space is that you're breathing into, and if you can explore alternate spaces, not necessarily closing off one space, but trying to explore alternate spaces at the same time as identifying where your breath goes without effort. And so in doing so, in a twist, you will be exploring more space, more of your 360 space, when we're in a position that is ordinarily a little bit more difficult to breathe into. That also helps to reinforce the integration between the costal muscles and the diaphragm. And when those are nicely integrated, we have a nice result of that freedom of breath, degrees of freedom of breath. Okay, so that is some practice work for developing greater space in different directions, first isolating certain things and loading up certain parts of our breathing apparatus so that we, just like in any other situation where we are loading, so that we are encouraging greater adaptation, and especially for muscles like the costal muscles, when we load them up, sometimes it even makes them easier to feel when they are producing their action than it is to have them unloaded and trying to create that effort in an unloaded scenario. So as well as helping to increase adaptation, sometimes adding load also helps to increase the sensation of being able to feel what's going on, okay? So if breath is something that you are working on, if a twist in general makes you struggle for breath, if it leaves you feeling out of breath or like you don't have breath availability, then working on these things first can be a really great way to encourage breath capacity and then reinforce it in a more active practice. In the detour work that we do, it's not so common that we instruct breath because it's quite complex, as you have noticed here in this practice. There are many pieces to it. And in the end, what we're looking to do, instead of necessarily inhaling and exhaling to a certain cadence of movement, we're looking for the ability to be able to inhale and exhale, utilizing our full breathing apparatus in any movement, in any direction. So instead of an exhale always being the lowering phase, we want to be able to breathe in and out during a lowering phase of movement, utilizing the full breathing apparatus. So this work is often a great way to prep for a more active practice in order to get things ready to go, where you will have more capacity and you'll be able to then integrate the diaphragmatic and the costal breathing work to reinforce those new patterns, those new habits. Keep in mind that breathing is one of our deepest, most ingrained habits, and so if we're looking to change it or modify it, it's going to take considerably more work than, for example, working on our lunge. Considerably more consistent work and for a considerable duration of time, okay? So just keep that piece in your back pocket. Thank you so much for joining me here in this practice. Hopefully you're feeling like you've already got a few extra degrees of breathing freedom. If you do, use it to try and keep it, and I will see you again soon in another practice.